Hello, welcome once again. Welcome back once again to this channel. Today I'm taking you through another solution or another part, or yes, another solution. And that is a mouthwash. The person presenting is by name Satyam Grace, and I'm glad to take you through how we or what we put in mind when we are preparing, when we are carrying out preparation of what we call a mouthwash, or we can say mouthwashes, because there are many. We can say mouthwashes. So there are a number of things that we need to know, because a mouthwash is like what we are going to put in our mouth to manage the different conditions, and majorly the common conditions we get in the mouth are maybe bad breath, and then we have bacterial infections, and then we can have the viral infections, and then we can also have the fungal infections in the mouth. So the mouthwashes always come majorly as antibiotics, antiseptics, and the rest, just to manage what is giving us discomfort. Okay, so we need to understand something about a mouthwash. A mouthwash is an aqueous solution which is most often used for it is deodorant, refreshing, or we can say antiseptic effect. It may contain alcohol, glycerin, synthetic sweeteners, surface active agents, flavoring agents, and coloring agents. So these are different excipients. Those who are already going through pharmaceutics, you can appreciate the fact that all these components are the different excipients that we use when we are manufacturing different pharmaceutical preparations, or when we are preparing different dosage forms. So mouthwash generally contains following substances. We have what we call antibacterial agents, which can include the alkaline phenol. We have hydrogen peroxide. We have what you call the buffered sodium perborate, thermoglycerin. Those are antibacterial properties or examples of antibacterial active pharmaceutical ingredients. Okay, so if you are required to prepare hydrogen peroxide 3% concentration, that is its specific use will be the antibacterial use. Of course, it will have a different preparation procedure. You'll have to generate a working formula for it, and then write a label for it, prepare it, and then pack the product. Okay, so these are some of the examples of the antibacterial active pharmaceutical ingredient. And then we have the astringent active pharmaceutical ingredient, which include the zinc sulfate, and then zinc chloride, and so many others. So we are going to look at one of the mouthwash or mouthwashes, and that is a sodium chloride mouthwash, compound sodium chloride mouthwash. So how are we going to prepare? What do we need to put in mind is what we are going to focus on and what we are going to base on. Okay, so preparation of a compound sodium chloride mouthwash, we need to know the different requirements that we need to have. We need sodium bicarbonate, we need sodium chloride, we need what we call concentrated peppermint emulsion, or we can say peppermint water. Other formulas or other pharmacopoeias give it to us as a peppermint water, others give it to us as concentrated peppermint emulsion. So all of it is the same thing. Okay, and then we have double strength chloroform water, which we just prepared in the previous lecture. Please, those who have not yet seen how a double strength chloroform water can be prepared, please check in this same channel, and at least have an idea of how it can be prepared, because one of it is used, we discussed already, we said it is used as a pharmaceutical aid. In other words, we use it as an excipient, and here we are already seeing an example where we are using it. So we see that we need double strength chloroform water, and then we need purified water to be also part of it. We also need to appreciate the different apparatus that you may need to use, because you may be required to choose the apparatus from many. So if you know what is required, you will be in position to choose the right apparatus. So the apparatus that we may need to use, we have measuring cylinder. So we can have more than one measuring cylinder depending on how many mils of what do we want to measure. Like I said in the previous lecture, that we measure liquids and then we weigh solids. Okay, so for liquids, all the liquids that we are going to interact with their preparation, we measure them, and we use a different apparatus that enable us measure. It can be a dropper, it can be a pipette, it can be a measuring cylinder, and your measuring cylinder can come in different capacities. There are those that measure up to a maximum of 5 mils. There are those that measure up to the maximum of 25 mils, and then we have those that measure to 50 mils, and then we have 100 mils, 500 mils, and then we have up to 1 liter, even more than a liter. Okay, so depending on how much concentration you're preparing, you choose the right measuring cylinder depending on which volumes you need to measure. Okay, then we need a conical flask. So we can either use a conical flask or a beaker. In this specific case, either of the two will be good. We need a steering rod. So a steering rod is required when we are using a beaker, because we cannot shake, or we cannot form a uniform mixture by shaking in a beaker, but we can make a uniform mixture by shaking in a conical flask. We need droppers to help us top up, get small volumes that enable us top up to the required volume. And then we need what we call filter funnels, since it is going to be an internal preparation. A mouth is a part of the internal parts of the body. So since it is an internal preparation, an internal solution, we need to filter. We need to have an aspect of filtering. That is why we need a filter funnel and then a filter paper to make sure that we at least try to test or control the physical instabilities that may have been in our solution. Then we need a weighing scale, and then we need packaging containers. Okay, so after knowing your apparatus and also knowing the requirements, there is need for us to have a working formula. Like I said in the previous lecture, a working formula is derived from a master formula. So this specific lecture, we have already derived a working formula for this preparation. So we see that we need sodium bicarbonate 1 gram or 1.0 gram. We need sodium chloride 1.5 grams. We need concentrated peppermint emulsion, or we can say peppermint water, 2.5 mils. And then we need double strength chloroform water for 50 mils. And then purified water sufficient to produce 100.0 mils. Procedure for preparation of this specific mouthwash. What do we do? What do we do first? What do we weigh? What do we pick? Something like that. So here I have not given you a procedure for measuring, a procedure for weighing. However, what is presented before you is a procedure for preparation, for compounding, for preparing this mouthwash. So this specific lecture assumes you have already weighed and you know the different basics of weighing, you know the different basics of measuring. So maybe briefly I can talk about it. You need to weigh sodium bicarbonate required grams, and then you need also to weigh sodium chloride required grams. In our working formula, we see that we need the bicarbonate 1 gram, and then sodium chloride we need 1.5 grams. So you should have weighed these two solids, and then after you weigh the two solids, you also measure peppermint emulsion, and then measure chloroform water or double strength chloroform water, and then you also measure water or purified water. Okay, you can measure it and have it somewhere. So we see that what we do first is get our weighed sodium bicarbonate and transfer it to a beaker. Like I said, we can either use a beaker or a conical flask. So when we transfer it to a conical flask, we shall add a small amount of water in it, and then we are going to shake to form a uniform solution. After we have formed the uniform solution, we can as well dissolve sodium chloride on a separate conical flask, transfer it to a conical flask, and then add purified water to it and shake. And then after we have done that, we have formed a uniform mixture of sodium bicarbonate, we have formed a uniform mixture of sodium chloride. We mix them together. You mix the two solutions and then stir to make a uniform mixture. Okay, so after that is done, we can either dissolve them separate, or we can first dissolve sodium bicarbonate, and then after we dissolve sodium bicarbonate, we add crystals of sodium chloride in a solution or in our dissolved sodium bicarbonate, and then we add more water and then stir. If we are using a beaker, we stir. If we are using a conical flask, we are going to shake vigorously to form a uniform mixture. Okay, so that caters for the first part where we say dissolve sodium bicarbonate and sodium chloride in purified water in a conical flask, or you can do that in a beaker. Both solids are soluble in water. Okay, both sodium bicarbonate and sodium bicarbonate and sodium chloride are soluble in water. So we dissolve both of them in purified water. After we have done that, we now have a mixture containing sodium bicarbonate, sodium chloride, and water. We have mixed all of them. So to that specific resultant solution, we are going to add 2.5 mils of concentrated peppermint emulsion that we had already measured. Okay, so we add it and then mix them well, forming a uniform solution. So we add it. If we are using a conical flask, we add it in a conical flask, and then we are going to vigorously shake. If we are using a beaker, we are going to stir the solution. After we have done that, we are going to add 50 mils of double strength chloroform water to the above mixture and then mix well, forming a uniform solution. So after we have done all that, we can filter the preparation and then transfer the above mixture into the 100 mils measuring cylinder. So we can filter after we have added all the other excipients, or we can also do the filtering before we add other excipients. Okay, so we can dissolve sodium bicarbonate, sodium chloride, and purified water together, and then after we do that, we filter it out. After we have filtered it, just remember our peppermint is a volatile preparation, so that we don't lose it easily. We can avoid filtering it at the end, and then prefer to filter it before we add the other excipients. That is the 2.5 mils concentrated peppermint emulsion, and then the 50 mils of double strength chloroform water. Okay. And also you find that you have a small volume to filter, and it will have filtered faster compared to when you filter at the end, where you will have a greater volume and it will take a lot of time for it to filter. Okay, so you need to put that in your mind, that since it is an internal preparation, it is a mouth, we have to make sure that we filter the preparation. Okay, so that is why we are filtering our preparation. And also the viscosity is not so viscous. For example, when we are going to look at linctors, we see that for them they are too viscous, may not need filtering, though they are going to be used for internal use, but we do not filter the viscous preparations. Okay, after you have done that, add sufficient purified water to above solution in a measuring cylinder to produce 100 ml of the preparation. There is what we call topping up to the volume. Yes, you top up, you add the water to make sure that it is up to 100 ml. So the topping up is done in the measuring cylinder, or adding of the 100 ml is done in the measuring cylinder. Okay, so that is what we have to do, and that is what we have to put in mind. Okay, so this is the method of preparation of a mouthwash. This is what you need to know when you're preparing a mouthwash. Dissolve sodium bicarbonate and sodium chloride in purified water. Do not dissolve them in peppermint or in chloroform water. Okay, remember our chloroform water here is working as a preservative, so we are not using it as a co-solvent. We can only dissolve it in chloroform water if it was a co-solvent, if we're using it as a co-solvent. The same happens to peppermint emulsion. We shall not dissolve our sodium bicarbonate and sodium chloride in peppermint emulsion, because peppermint emulsion is not acting as a co-solvent, neither is it acting as a vehicle. Okay, so you have to know that. That's the basic that we need to know. Every excipient we have, know what is the role of that excipient in that specific preparation. If you know the role, you will not mix things up. Okay, so we have after we are prepared, we need to pack. So we have a procedure here for packaging or packing the product. What we need to do first, always when we are packing, choose appropriate packaging material. Therefore, mouthwash, majorly we prefer a narrow mouth, screw kept, colored, fluted bottles. Okay, and then after you have selected that, clean the packaging material with clean running water and a detergent. After you have done that, rinse your container and wipe with a clean cloth. Transfer 100 ml of the solution to the packaging material using a funnel to avoid spillage. So here I have not repeated the step of tearing because we already discussed about it in a previous class or a previous lecture. Please check out for the previous lecture and see the explanation on how a container or a packaging material or a packaging bottle can be teared. Okay, and what is the role of tearing, what is the need to tear, something like that. So you check in the previous class or a previous lecture that we already discussed. After you have transferred your 100 ml of your mouthwash successfully, you close the packaging container tightly and then store your product in a cool, dry place. So after all that is done, we have to write a label. We need to write a label for every product we prepare. Okay, so for this specific mouthwash, we prepared 100 ml. That is why we are having on top 100 ml. If we had prepared 500 ml, we have to include the 500 ml. If we had prepared 1 liter, or we have packed 1 liter, we also indicate that this is 1 liter, 20 liters, 300 liters, depending on what you manufactured. So after you have done that, you give us the name or write the name of the preparation. So the name is compound sodium chloride mouthwash, and it is a solution. We are more specific on which category of the liquid dosage form this mouthwash belongs. So that's why we are saying compound sodium chloride mouthwash solution. After we have done that, we write the composition, what is inside our mouthwash. We have sodium bicarbonate. You can either write them in this format, or you can write it in their percentage concentrations. Percentage concentrations can as well be derived from this, where we shall have 1 gram divided by 100 mils total total volume. The whole volume here is up to 100. So you can say 1/100 times 100%. That will give you 1%. Here we shall have 1.5%, and then that will be weight in volume, because this is grams and these grams are in weight. So this will be weight in volume. Also here shall be weight in volume. However, this will be volume in volume. The 50.0, when we convert it as well, we shall have 50% volume in volume, and then the last will be 100% volume in volume. Okay, so that is another way of writing. You can write it in concentrations, percentage concentrations, converting everything to percentages. Are we together? Yes. So that's what you can do when you're giving the composition. You can either write how I have presented it, or you can write it with their percentage concentrations. After you have done that, you need to give direction for use. Most of the preparations, we direct them, or we give direction as directed by the physician. And then the use for this specific mouthwash is what you call, it is used as antipyretic. Antipyretic is a compound or those different preparations that prevent itching, or that control itching. There are some oral conditions in the mouth that bring about discomfort. You feel the tongue is itching. So in such a case, we recommend our sodium chloride mouthwash to such patients. So how a caution we need to have, or you need to put in mind, that mouthwash should not be swallowed in large amounts. In other words, a patient should not swallow the mouthwash. Why? Because if a patient swallows the mouthwash, remember this mouthwash is managing maybe the bacterial infection in the mouth, the viral infection in the mouth, the fungal infections in the mouth, and by it passing in the mouth, you find that it has destroyed some of the bacteria in it. It has destroyed some of the fungi in the mouth. So if a patient swallows, meaning this patient is swallowing this bacteria and will also affect the internal system, this patient will have swallowed the fungi, which will also affect the internal system. That's why we encourage our patients not to swallow, because it is risky and it is dangerous for them to swallow the medicine or this mouthwash. We always advise them, after they have rinsed, after they have cleaned the mouth, they spit it out. Okay, so always when you're dispensing out a mouthwash, this is what you need to put in mind. Your patient should not swallow, and then tell them how they need to use it. Okay, storage: store in a cool, dry place and keep out of reach of children. And then the batch, we have to allocate the batch, which for this preparation we allocated 002. Manufacturing date, we always take a period of 1 month, so that our products, like I said in the previous class, that most of our preparations that we do in the lab are not for consumption. They are for study purpose. And since they are not for consumption, we find that we are not carrying out the different quality control tests, the different quality assurance techniques, the different procedures are not followed to make sure that the product is sterile, the product is ready for use. Okay, and as you're preparing, since you are learning, you may also make errors, and those errors we always prefer to monitor them for a period of 1 month. Okay, so if quality control tests are done, a manufacturer can allocate greater than 1 month expiry date. Okay, so if they carry out the different tests on the physical stability of the product, the microbial stability, and then the chemical stability of the product, it can be ready for use, and it can take more than 1 month expiry, or it can take a greater time. You find that even they will have to look out for the bioavailability of the product. They have to look at the therapeutic window, the therapeutic index, the potency, the efficacy, the purity, the uniformity. Those are a number of quality control tests that they need to carry out on each product or on different products. Okay, so for our purpose or study purpose, we shall go with 1 month, one period, or a period of 1 month, since most of the quality control analysis are not put into considerations. However, in different manufacturing facilities, they will allocate more than 1 month because they carry out different quality assurance tests, and then precautions, and a number of things. After you have allocated your product expiry date, we have what we call a manufacturer. You put your manufacturer's name, and for this specific preparation, it is prepared by Grapharm Academy Pharmaceuticals, and then the manufacturer address is Gulu, Uganda. So that is what you needed to know about sodium chloride mouthwash. In case you have any questions, you can put them in the comment section, and then we shall address them. However, I have also questions here for you that you may do it in your free time. That is, what are mouthwashes? And then what is the difference between a mouthwashes and goggles? And then how is a mouthwash prepared? What is the use of a mouthwash, and what is the purpose of a mouthwash? Otherwise, thank you for listening to me. If you came this far listening to this specific method of preparation of a mouthwash, meaning you liked this specific lecture, and I ask you to keep tuned and always tune to this specific channel for more pharmaceutical preparations or more methods of preparing different pharmaceutical preparations. Okay, I wish you all the best and good luck. Thank you. Grapharm, this is Grapharm Academy. Keep loving Grapharm Academy, and then like, subscribe, and comment. Thank you.